Okay, so now I'm going to introduce you to some exercises to help you alleviate that dorsoscapular nerve entrapment. And if you've skipped ahead, if you've hit the timestamp and you've just skipped ahead to these exercises, or if you're watching these exercises as a standalone without having watched the PowerPoint presentation, the short one that I did just prior to this, that's fine. I highly suggest that you go back and review that if you haven't seen it already, or if there's been a delay between the time you've watched that and the time you're watching these exercises, because it's important to know why exactly you're doing an exercise for a couple different reasons. One, if you know why you're doing it, you can do it the right way. Two, if you know why you're doing it, you can maybe even find a better way to do the things other than what I suggest for you. You can find modifications that work for you, or better exercises or better therapies, whatever it is. And three, if you know exactly why you're doing it, you're going to continue to do it. And that's the most important thing. Making sure that when you're doing some self-care, some prehab, rehab, some self-rehabilitation exercises, that you're consistent with it. So let's think about exactly why it is that we're doing it. The muscles that are most impacted here on the neck, right? These are the trapezius muscles, the levator scapula, the rhomboid, and the scalenes, right? These four muscles that are responsible for pulling the shoulders back, pulling the shoulders up, pulling the neck back, rotating the neck, right? That's what these muscles are for. We talked in the PowerPoint presentation that when a muscle's in spasm, the muscle becomes spastic because it's not receiving enough oxygen, it's not receiving enough glucose, it's not receiving enough electrolytes. It's in the same way that somebody has a heart attack and they start to experience fibrillation of the heart because there's not enough oxygenated blood getting to it. And then you have to send an electrical signal, an electrical impulse through an AED device to wake that up, to push the carbon dioxide rich blood out and to pull the oxygen rich, glucose rich blood back into the heart so that way it can continue to do its thing. We have to do the same thing with these muscles, right? So you've got this nerve, this dorsoscapular nerve. It runs from the fifth and sixth cervical vertebrae here in the neck, and it runs towards the shoulder, down behind the shoulder blade, and down the arm, wraps around the armpit, connects with the brachial plexus, which goes down the rest of the arm, which is one of the reasons why when we have entrapment here, that you can also feel numbness and paresthesia, tingling or weakness, and in more extreme cases, atrophy of the muscles in the arm on the affected side. Okay, so I'm starting to ramble a little bit, but the reason why we're going to do these exercises is because, again, when a muscle is in spasm, that muscle is either taken to a length that's too much, right? It's too lengthened. It's become too stretched, or the opposite has happened where it's become too contracted, right? And if you look at my fist, as I squeeze my fist, you can see my hands, they begin to turn white, right? So that's excessive contraction. Same thing, if I take my finger here and I stretch it, you can see that it's becoming whiter than it was before, right? So when a muscle is either excessively extended or excessively contracted, inadequate, you don't get enough blood flow to the muscle tissue. All right, while we're doing these exercises, this is what I want you to be thinking about, because what we're going to be doing is we're trying to force blood into the muscle tissue. It's more about blood reaching the target tissue than it is about changing the shape of the muscle itself. This is the reason why a lot of times when people have pain here, they try to stretch their neck and it doesn't really work, and sometimes it makes it feel worse, or maybe sometimes it makes it feel better temporarily, but then it comes back sometimes with a vengeance. It's because the goal is to inundate the muscle tissue with blood. When a person gets a massage, this is what's happening. When a person does appropriate types of stretching or strengthening exercises, that's what's happening. Okay, so we're going to divide this into two different types of exercises. The first one is a contraction exercise, and the next one is a contraction, stretching, and mobility exercise. So the first one requires a band. It doesn't have to be anything special. I don't know if you could see this. I got this at like a walk-by booth at a parade near my house, right? Just like one of these typical stretchy bands. And I'm gonna put it here. And what we're gonna do is we're gonna focus on two different levels. So I'm gonna sit up nice and tall. I'm gonna identify like where my nipples are. Yours will probably be different, but I'm looking actually for kind of like the center of my sternum. And then I'm looking for the bottom of my sternum where the thing called the xiphoid process is, that little sensitive patch here, also known as the solar plexus. So here and here, I'm gonna bring the band in alignment with that first section. And what I'm gonna do is I'm gonna squeeze the area between my shoulder blades, hold for a second, back, squeeze, back, squeeze, back. And I'm gonna do this about 8 times. Trying to touch the band to my chest. So this way, this makes sure that I'm bringing those shoulder blades back behind me and I'm squeezing them together. Okay, so pretend that's 8. And now I'm gonna bring it down a little bit lower. I'm gonna find that xiphoid process, that solar plexus area, and we're gonna basically do it at that level too. So here, 1. And the reason that we're targeting these 2 different areas is what we're doing is we're turning on and we're stimulating this trapezoid-shaped muscle in the upper back and middle back called the trapezius. And there's 3 different fibers, 3 different sections. There's the upper fiber that everybody knows from having the big traps. There's a middle section between the shoulder blades, and then there's a kind of like the bottom of a diamond shape that comes down and connects right at your lower back. So when we're doing these movements at these 2 different levels, here I'm really focusing on the middle fibers of my trapezius. When I bring it down, lower fibers of my trapezius. Okay, so why is that important? One is because the trapezius muscle is one of the ones that happens to go into spasm, right? We talked about in the PowerPoint presentation that the muscle, the nerve, the dorsoscapular nerve is actually closest to the levator scapula, to the scalenes, and also to the rhomboid minor. But the trapezius plays a big effect as well. Because also, if you remember in the PowerPoint presentation, one of the causes, the etiology, the pathomechanism, one of the reasons why this nerve gets impinged is because of our posture. When our shoulders roll forward, you can see what happens. My posture comes forward, shoulders roll forward, and what's happening? Those muscles on my back between my shoulder blades are becoming set in a locked long position. If you remember from the presentation, we have locked short, locked long. I've put those muscles in a locked long position. In the meantime, the muscles on the front of my chest, in front of my shoulders, are now in a locked short position, right? And there's other nerves, the whole brachial plexus that innervates the entire arm and hand actually runs through here. So, a lot of times this dorsoscapular pain is a combination of 2 different things. There's the impingement of the dorsoscapular nerve near the shoulder blade on the backside, but then also the brachial plexus, the axillary nerve that runs through the collarbone and down through the chest, right? So if I've closed here, if I'm too closed here and too open here for long periods of time, those muscles are going to spasm. So why are we doing the trapezius exercises? Middle and lower fibers of the trapezius will actually pull my shoulders naturally up and back. The upper fibers of the trapezius actually pull my shoulders up and forward, right? Upper fibers, lower middle fibers. So we're turning those on as a way to, 1, inundate that area with blood, with good oxygenated blood, and 2, helping to correct the posture. So that's the first one. The second one, after you've done this for either 1 to 2 sets, right? Again, as a reminder, you have 10 here, 10 here. Then I'm going to show you this from the side, right, with my fancy camera work. We're going to interlace the hands, and I don't know if you can see it, but my fingers are interlaced. I'm going to squeeze my palms together like so, right at my sacrum level. And then I'm going to roll my shoulders back and down. Now what this is doing is further stimulating those muscles, middle fibers of the trapezius, lower fibers of the trapezius, and now we're also bringing the rhomboids in and we're holding in that position, right? Again, because a lot of times the postures, everything is locked long on the back, locked short on the front. What we want to do is equalize and normalize. So I'm going to equalize, normalize my posture. I'm pushing my hands into my sacrum, peeling and pulling my shoulders back together. Sometimes you can think about it like squeezing your elbows together. And now I'm going to exercise my neck. I'm going to extend and flex. Extend and flex. Extend, flex. And I'm going to do this 10 times. After the 10th time, now we're going to keep the shoulders where they are. Now we're going to go ear to ear. Do this for 10 repetitions. And then look over the shoulder. And do this for 10 repetitions. Last is we're going to bring our neck all the way around. Now notice I'm squeezing my shoulders up as my neck comes back. Squeeze up, back. I'm not taking my neck to an end range of motion. I'm doing the mobility, right? 5 to 10 repetitions in either direction. I'm doing the mobility without taking my neck to an end range of motion. I don't want to overstretch the muscles. Again, what I'm trying to do is I'm trying to reestablish the appropriate length for the muscle. The muscle wants to be in a neutral position. When it's taken out of a neutral position, it's going to suffer, whether that's overly long or overly short. So the combination of the bands, the two different levels, the mobility, side, side, rotate, rotate, circumduct, circumduct, right? Do these exercises 4 times per day, 5 times per day. The caveat is if you have severe pain when you do this, right? If every time that you do one of these motions, it stimulates and triggers that pain down the arm, you will definitely want to work with a physiotherapist who will probably have you do very similar exercises, but to do it in a supervised way. If when you're doing the exercises, you have discomfort local, that's okay. If you have a mild aggravation of tingling numbness down your arm, that's okay. Because what you're doing is you're integrating a new movement and your body needs to accommodate. If as you continue to do these exercises 2, 3, 4, 5 days down the line, if that is not changing, if it's not decreasing, if it's getting worse, then these exercises just aren't appropriate for you in this time. So I hope all this is helpful for you. I'm doing my best to take all this information that I've learned about physiotherapy, about neurology, about therapeutic pain neuroscience, and deliver it in such a way that it's actionable and useful to you. Because, I've dealt with chronic pain, chronic neck and shoulder pain for most of my life after a parachuting accident when I was in the military. Learning things like these not only helped me to manage the pain, but eventually got it to the point where it's no longer as big of a part of my life, although it's still there. And that might be a different video for a different time, explaining exactly how and why chronic pain sticks around, why it's so sticky. But as far as the physiological, the mechanical aspects, doing the exercises like these, I think, are extremely important, regardless of whether you do acupuncture, if you do massage, if you do radiofrequency nerve ablation, if you do the TENS, the electrostimulation, if you have some type of injection, if you're taking a medication, it doesn't matter. The reason this is important, I believe, is because this is empowering for you. These are things that you can do on a regular basis to greatly impact and increase the quality of your life. Okay, that's my soapbox. That's all for now.